Today we will be going over radiographic interpretation of periodontal disease. So as we go through this, it's important to note that we will only be going over what's necessary to know for your radiography class. So the only stuff we'll be going over is what bone loss and periodontal disease appears like when looking at a radiograph. Everything else you're going to learn in your periodontal class. So the class that you learn about the periodontium will cover everything else. So all we're looking at today is just the periodontal disease cases referring to the bone loss that you can see radiographically, and we'll discuss the different components when making that periodontal disease diagnosis. So it's important to remember that when you're making a periodontal disease diagnosis, one of the things that you've already used in clinic is your periodontal charting. So you've done probe depths, you've done your clinical attachment loss, mobility, furcations, and bleeding on probing. The other important factor in everything, and probably one of the main components of periodontal disease, is the loss of bone. So radiographically, we can use your radiographs to look at how much bone has been lost in certain areas. Always remember too that although we can see that we've lost bone, we have to remember that a radiograph is a two-dimensional representation of a three-dimensional object. So we still need more information than just a radiograph. So both clinical and radiographic examination are both important. So we use a radiographic examination to provide an overview of the amount of bone present. So we can indicate patterns of bone loss, distribution of bone loss, and severity of bone loss. When taking radiographs to determine bone loss, a periapical radiograph is the image of choice for evaluating periodontal disease. And if you're looking for caries, a vertical bite wing would be recommended over the horizontal bite wing. When taking a periapical image, a paralleling technique is preferred because sometimes when you're doing the bisecting technique, it can actually distort bone loss and make it look like there's less bone loss than there actually is. When you're evaluating bone, the panoramic film is completely not recommended, mostly because there's very little diagnostic value to see anything for periodontal disease when taking a panoramic image. And that's mostly because you can't see any of the specifics. In periodontal disease, you need to see very specific fine changes in the bone. So what we'll be doing next is we'll do a quick review of the periodontium, and this is all information that you learned in oral facial structure, so this should just be a review. So the first thing we'll go over is the lamina dura. So lamina dura, or our cribriform plate of bone, is what houses the root of the tooth. So in a healthy tooth, we're going to see this radiopaque line that outlines the entire tooth. So in this image, you're not usually going to see the lamina dura quite as well as you can see here. But this is a good image that you can see this radiopaque band. There's our lamina dura. Also important to remember is our alveolar crest. So in health, our alveolar crest is about 1.5 to 2 millimeters apical to the CEJ of adjacent healthy teeth. So this is in health. For anterior teeth, the alveolar crest is pointed and sharp, and it appears much more radiopaque than our posterior teeth. Our posterior teeth, the alveolar crest will appear more flat and smooth and should be parallel to the lines between adjacent CEJs, and we'll go over that a little bit more. Now, what's another important thing to remember is our periodontal ligament space. So the periodontal ligament space is that thin radiolucent line between the root of the teeth and the lamina dura. It should be continuous around the root structure and uniform in thickness, and that's how it should appear in a healthy tooth. So in an unhealthy tooth, you start to get widening of the periodontal ligament space. So that's one of the telltale signs of the start of disease. And here in this image, we can see this radiolucent area here between the lamina dura and the root. So right here is our periodontal ligament space. So there's different ways that you can describe bone loss when looking at it radiographically. So you can describe bone loss by its pattern, its distribution, its severity, and what's causing the bone loss. So what we'll first go over is the pattern of bone loss. So your pattern of bone loss can be described in two ways. It can either be described as horizontal or vertical. When we're describing it as horizontal bone loss, we're saying that the bone loss has occurred in a plane parallel to the CEJs of adjacent teeth. Whereas with vertical bone loss, we're saying that the loss of bone does not occur in a parallel plane to the CEJs of adjacent teeth. So if we look at this image here, let's determine if this is going to be horizontal bone loss or vertical. So the first thing here is I trace this line where I have my bone loss here, And then I go to my CEJs and I trace a line connecting the two. So if these two lines appear parallel, this is determined to be horizontal bone loss. So these lines look pretty parallel, so I'm going to call this horizontal bone loss. Now I move over again, between 4 and 5, here I have my line here, and I have my line here, between CEJ and CEJ. These lines look pretty parallel to me, so I'm going to turn this horizontal as well. It's important to note that just because these two areas are horizontal doesn't mean the whole mouth is going to be horizontal. You can have both horizontal and vertical bony defects. So let's look at this next image here. So I'm going to trace between CEJ to CEJ, and then I'm going to trace here my crestal bone. So this does not appear parallel. So this here is going to be vertical bone loss. When I look at all these teeth, I'm also going to be looking at the big picture here. So I also want you to look at, do you see this dark area between the roots here? We have some furcation involvement here on tooth number 19. I also can see what looks like some radiolucency underneath this crown. So maybe we have some recurrent caries here as well. So let's look at this next one. So when I look here between tooth numbers 12 and 13, this one's pretty obvious. Obviously nothing's going to be parallel to this. So here we definitely have some vertical bone loss. When I look between 13 and 14, I'm connecting my CEJs. And here is my level of bone, my crestal bone. Still does not appear parallel, so this I'm also going to determine as vertical. Now between 14 and 15, when I trace my CEJ to CEJ and my crestal bone, these lines do look parallel. So this I would determine as horizontal. Same thing when I go over here between 15 and 16. These lines are parallel, so I would consider this area to be horizontal bone loss. I also know this patient's developing some more severe periodontal disease because I can see the widening of the periodontal ligament space. Remember we said widening of the periodontal ligament space is a good way to determine periodontal disease. So here I can trace this radiolucent line bordering the roots of the teeth, so I can see widening of the periodontal ligament spaces here. So another way that I can classify periodontal disease on a radiograph is to determine if its distribution is localized or generalized. So localized bone loss, you're talking about bone loss in a localized area, and generalized, you're talking about throughout the dental arch. So if someone has localized bone loss, again, you want to be thinking to yourself, why does this person have bone loss in this one specific area? And we'll go over in a few slides what would cause someone to have bone loss in one specific area. Generalized, you're talking about bone loss that's throughout most of the mouth. So this is what you'll typically see in a patient with poor oral hygiene who has bone loss throughout the majority of their mouth. So usually they're not brushing properly, they're not coming in for their annual dental prophylactic or dental cleaning appointments. You can also classify bone loss on a radiograph by the severity of the bone loss. So you can classify it as mild, moderate, or severe. So mild bone loss, you're talking about some crestal changes, nothing very dramatic, but you are starting to see some change. Moderate bone loss, you're talking about bone loss where you've lost about 10 to 33% of bone. And severe bone loss, so we're talking about bone loss of 33% or more, so someone who has lost more than 33% of bone. Severity can also be classified by ADA classifications of periodontal disease. So again, we can't make perfect descriptions of the periodontal disease classification just by radiographs because we need more information. We need bleeding on probing. We need probe depths in order to make a full diagnosis. But we can still classify what we see on a radiograph based on just the amount of bone loss alone. So we can say, we can take a look at type 1, 2, 3, and 4. So when we're looking at case 1, we're talking about gingivitis. So with gingivitis, we have no associated bone loss. So all crests are within 1.5 to 2 millimeters from the CEJ. So radiographically, we don't see any changes in the bone. So how would we know if a patient had gingivitis if we see no changes in the bone? Again, we have to do a periodontal chart. So that's something that we would obviously need to be doing clinically. When I look at this radiograph, Just as a side note, I can see a lot of cervical burnout here. Everyone can see that here, just below the CEJ. That's all cervical burnout. It's a nice image also of our mental foramen. And then our ADA case 2, so it's going to be early periodontitis. So this is associated with more mild crestal changes. So our crestal bone may appear more flattened, maybe a little bit deeper than 2 millimeters. So when I see this here, I can see it pretty well when I'm looking here between our molars here. I can see here's my CEJ, and I definitely can see some loss of bone. And if I'm not sure how much bone I've lost, I can see that there's calculus here, so I see a local irritant that would cause me to lose bone. In our case 3, we have moderate periodontitis. So this is associated with more like 10 to 33% of lost bone. The patterns of moderate periodontitis may be horizontal or vertical. They can be localized or generalized. And you can also see some furcation involvement starting here as well. So again, you need to keep in mind that you can say that certain areas may have moderate periodontitis, certain areas have horizontal bone loss. Everything depends on how much there is throughout the mouth. So when I look at this radiograph, I can definitely see there's more than just a little bit of bone loss here. So when I'm just looking at this, I can see more bone loss than with case 2. And we're starting to get maybe a little bit of furcation involvement when I look here. And I can also see calculus as well. So this patient probably has poor oral hygiene. If I want to look for the pattern of bone loss, so if it's horizontal or vertical, I'm going to trace my bone levels. So here's my crestal bone, here's my CEJs. So I would definitely say that looks pretty parallel. So there's horizontal. Now when I look between 5 and 6, so this is why I said it's very important not to just simply eyeball it. Because here, if I looked between 5 and 6, I would assume this looks vertical, because this area looks more vertical than the rest of the areas of crestal bone. However, if I trace this, and then I trace from my CEJ to CEJ, this is still parallel. So this is still going to be classified as horizontal bone loss, so don't let that mess you up. It's an easy thing to make a mistake with. And then next we have our ADA case type 4, which is advanced periodontitis. So advanced periodontitis, we're talking about more severe bone loss, so we have lost more than 33% of our bone. So when this happens, we definitely want to evaluate what's causing us to have such a severe amount of bone loss. So when I look at this image here, I want to say, why do I have so much bone loss in this area? So I look and I see here, maybe I'm missing a tooth. So maybe I'll count backwards. So I can definitely tell that this is tooth number 6. This is definitely our canine, and I can tell from the appearance of the crown and how long that root is. So maybe I'm missing a premolar here in this area. I can also tell my molar here is super erupted, so there's definitely something going on. I'd like to see what the mandible looks like. I'd like to see the patient history. So we definitely want to see what's going on that's causing the patient to have such severe loss of bone here. All right, and so another thing you can look at in your radiographs are predisposing factors. So what are things that are causing us to lose bone? Because sometimes if you're just talking about poor oral hygiene, when you see just generalized bone loss throughout the mouth, we can assume poor oral hygiene, biofilm, and pathogenic bacteria causing us to lose bone. But sometimes there's other things that are causing it as well. So looking at this radiograph, this is pretty severe, but we can definitely say a predisposing factor for this patient losing bone might be faulty margins of restoration. So look at this giant overhang. We have so many giant overhangs between all these teeth. And then look at all the loss of bone here. We've got furcation involvement. We've got some bony defects here. So there's some pretty severe loss of bone. We can also see here some calculus as well. And again, calculus is going to be a local irritant. So calculus can also be a factor in losing bone, obviously because we are trapping biofilm and pathogenic bacteria underneath that calculus. It can also cause us to lose bone. So other things that can cause us to lose bone, like predisposing factors or local irritants, include if a patient has an open contact. So an open contact can trap more food, it can trap bacteria, it can be difficult for a patient to keep clean, so they might be more likely to develop bone loss in one of those areas. Restorations with poor contour, restorations that have uneven margins, especially definitely overhanging margins, or even inadequate margins. So a lot of times when you're looking at the teeth, you want to be looking for faulty restorations like you do in clinic. You check with the floss, make sure we don't have any open contacts or overhangs or things like that. So we're just going to be going over these radiographs. So we'll see what it is that you can see and what kind of classifications you would put these radiographs. So definitely try to do this by yourself after we go through this in the lecture. So in this top radiograph here, what kind of bone loss are we looking at? I'm definitely assuming that this is some pretty advanced bone loss. I mean, look how much bone we've lost here. We have some furcation involvement as well. But as we said, before we can make a full diagnosis, I want to see what my clinical examination is. Do I have bleeding on probing? Are my teeth mobile? I want to know things like this. When I look at this image here, a few things go through my mind. So I would say, looking at these mandibular teeth, so when I look at 20, 21, and 22, it looks like I might have the start of some bone loss, so maybe like some mild, maybe case 2 bone loss here. But then when I look over here, I have this huge, more severe bony defect. So I definitely can say here I have a localized bony defect, a localized, more severe periodontitis, with more generalized case 2 mild bone loss. However, why am I not saying anything about the maxilla? Does anyone have any idea as to why I can't really make any decisions about the maxillary bone? Well, we can't make a decision about it because we can't see it. So this was the incorrect type of radiograph to take in order to evaluate this patient. This patient should have definitely had a vertical bite wing. So with a vertical bite wing, I'd be able to see my crestal bone, and I'd be able to tell if I had advanced bone loss, if I had severe bone loss, or if the bone is just right there and I just can't see it from where we are. I can't tell if I have horizontal bone loss or vertical bone loss. So in this case, I definitely should have taken a vertical bite wing. So on our next image here, so we'll look at this top anterior PA first. So when I look here, I have a great image of some local irritants. So my local irritant here is calculus. So I can see huge calculus deposits here on these teeth. I can also see widening of the periodontal ligament space and some pretty severe bone loss. So if I were to take a look at this radiograph, I would also want to be thinking, what might this look like clinically? Clinically, I would probably see some of this calculus. I would definitely see some severe inflammation in the area, and I'd probably have some mobile teeth as well. Over up here on this radiograph, I have the same thing. I can see large areas of calculus deposits and more bone loss. This looks a little bit more like case 3 to me. And maybe up here, maybe some case 4. Again, this maybe should be a vertical bite wing, so I could see more of the bone loss up on the top here. So when I look at this radiograph, and even this one on the bottom, if I were to be in clinic and I was to be doing scaling and root planing, I would want to make sure that I had my radiographs up so I could look at them while I was scaling. Because what a great cheat sheet that you have right here. Here's some calculus. If I was scaling these teeth down here, here's some calculus. I definitely have some calculus under this crown on either side. So this is a great cheat sheet that you can use while you're doing scaling and root planing, and you'll do this in clinic, and you will do this in private practice as well to see where your calculus is, to see what you're feeling. Because if I see this, I know that there's some calculus on the distal of that tooth. So with this patient, we would definitely want to talk about scaling and root planing or referral to a periodontist just to evaluate the amount of bone that they've lost. And now, for the rest of your time while you're going over this, I do think it would be important to go through these slides as well on your own. Determine if you think that what the pattern of bone loss is, what the severity, if it's localized, if it's generalized, different local irritants, because this is one of the most important things that you can do because you're a dental hygienist. This is your job. You will be the first-hand people checking to see if people have bone loss. You will be doing a lot of the periodontal charting. You're doing their cleaning. So make sure you're really looking into this so you can give the doctors the right information that they need in order to make good diagnoses for their patients. All right, thank you and have a great rest of your day.